Crazy story. Only 41 GP clinics in WA that are fully bulk billing, biggest drop in the country. And joining us now is the AMA WA President, Dr. Michael Page. Dr. Page, good morning. How are you?
Good morning, Simon. Very well, thank you.
Are you seeing this?
Look, absolutely. It is the case that over the last few years, bulk billing has become an exception rather than the norm in general practice, and not without good reason. I mean, it's a reflection of the fact that the federal government's payment to patients to cover the cost of seeing a GP has stagnated. So the Medicare rebate that patients receive to see a GP has stagnated for many, many years, and general practices are private businesses. By and large, they're private businesses. That rebate that's attributed to the patient that the practice can claim on the patient's behalf in a bulk billing situation, that doesn't just pay the doctor, it pays the reception staff, it pays the nursing staff, it pays for the electricity, it pays for the water, it pays for the rent, it pays for every part of that practice's costs, or it's supposed to. And it's just not enough to run a practice anymore. So most general practitioners have found it necessary to charge out-of-pocket fees on top of the Medicare rebate. So it's not surprising at all.
Does it mean that people might stay away from visiting a GP? Because we've always heard that we want people to stay out of the ED, out of the emergency department. We'd rather go to a doctor if it's something that the doctor can fix or can look at. Is it likely that, like is the case often with dentists, that people are less inclined to go, Michael?
Absolutely, that is a risk that any disincentive to go and see the GP, including a financial hurdle, which it is for many people, it does get in the way of people wanting to go and see their GP, and so access to care is reduced as a result, and that will have serious impacts on the health system down the line if people aren't seeing their GP for those routine preventive health checks, getting their blood pressures checked, getting their cholesterol tested, all of those other things that can prevent further problems down the line, then the cost to the health system in the future will be much, much higher as people get admitted to hospital with the consequences of chronic diseases that weren't detected early enough and weren't treated early enough. So it is a major risk.
In recent years, Michael, we've seen the rise of people going online or going on their phone to get a doctor's consultation and also get a prescription. But those rules have changed as well recently, haven't they? It is more difficult to get a prescription online or through your telephone now.
Yeah, absolutely. I mean, the medical board understandably has some serious concerns about these sort of text-based or very brief phone-based consultations for getting a repeat prescription or a blood test or whatever it might be. And I would share those concerns, actually. I mean, it's not quality medicine. It's not, there's no continuity of care there. But of course, the whole health system does need to adapt to the fact that people do want more convenience now. And that's because people are have a sense of self-entitlement or anything like that. It's actually because people are busy now. We've got huge cost of living. People are working more than one job. Mothers and parents are both working. Everyone's busy. Access to care has to be not just affordable but also convenient and accessible. Increasingly, I think, for it to meet the needs of the modern community. All right, Michael. Thank you. Thanks for your time on this Monday morning. Have a good day. Appreciate your time.